So good morning, everybody, and welcome to our first of our South Yorkshire Bitesize series. My name is Gemma Ridley and I'm the Director of the South Yorkshire Innovation Hub. So today's session will focus on our theme of cancer, and we're delighted to be joined today by Liz Purnell from Sheffield Teaching Hospitals, and we'll follow up her presentation with a Q&A. So the webinars in this series highlight research innovation best practice across South Yorkshire and run weekly from September to January next year, with each month focusing on the following themes. So obviously cancer is today's one. We've got children and young peoples, we've got prevention, we've got workforce, and finally economic participation. And in line with the 10-year health plan, we wanted to maintain the energy around innovation as a national priority. With innovation driving progress, it enhances problem solving and fosters growth, which will forever support part of our health and care industry. So we hope you'll feel inspired by our speakers today, gain some insights into research, innovation and delivery, and take away any tips you can use in your local workplace or system. And I am now going to pass you over to our speaker, Liz, to talk to you more about the benefits of facilitated group psychological support for teenage and young adult cancer teams. So Liz, over to you.
Thanks, Gemma. That's a bit of a mouthful, isn't it, really, for a Wednesday morning? But hello, I'm Liz Purnell. I'm going to hopefully share my screen with you so you can all see it. There we go. So yeah, I'm Liz Purnell. I'm the Teenage Cancer Trust Lead Nurse for South Yorkshire, North East Lincolnshire, North Derbyshire and North Nottinghamshire. I'm coming to speak to you basically about sessions that we've put on to support our teenage and adult staff. We call TYAs throughout, it just means teenage and adults, just because it's easy to say. So what are we? We're a team of nurses, youth support coordinators, social workers, MDT coordinator, psychologists and medics who support young people aged 13 to 25 with a cancer diagnosis. We support young people throughout their cancer treatment, both in the hospital and at home, and we work together as a team to keep their lives as normal as possible during their treatments. We also support young people who there may be no cure, so it could be palliative, or just have cancer for a very long time. And part of our work is to provide that holistic care. So we support families, partners and friends, and we even support during the bereaved time. But working with teenage and adult cancer care is often viewed as incurring a lot of stress and emotional burden for teams. Compassion fatigue amongst healthcare professionals working in oncology can be commonplace. So supporting staff with this psychological burden can help reduce the likelihood of staff burnout and can improve overall well-being, with self-care and engagement in mindful activities being shown as to improve staff reported outcomes in compassion fatigue. So the question we always get asked is, how much does it cost? Hence the money and the clock. And it's that really. Is it the financial cost you're asking for, or is it the time that you're asking about? So the general perception amongst the team is that we needed some support, helping look after our young patients. So we thought that actually having group sessions as a team would actually help benefit us. So we wanted to be able to discuss difficult situations and issues that we face, and we wanted to develop our skills in areas of resilience. Additionally, the aim of the sessions was to find a robust support system that could be embedded in our routine functioning. And myself, as the lead nurse and one of our senior clinical psychologists, did a scoping exercise of the team to identify what type of intervention would benefit the team as a whole. Considerations included if the group sessions would need to be structured or semi-structured, who would be able to facilitate the sessions, and kind of where we would have them. And we also wanted the psychology team to be part of these sessions because they do also support our young patients. So as a result of the scoping exercise and team discussions, decided that the intervention would take the form of group sessions facilitated by a cognitive behavioural therapist, or a CBT therapist, who had no previous relationship with the TYA team. The CBT therapist was also really new to Sheffield Children's Hospital, who provide our psychology services, when we set the innovation up, and they had no previous working relationships with any member of our team, which was great. Gave a fresh blank canvas. But because of the pressures of increasing workloads for all the team members, it was agreed that the sessions would take place every 2 months, approximately an hour a time. And we looked at shift patterns, clinic times, prior commitments that we all had in our diaries. And just for the majority of the team, it worked out Thursday afternoons were identified as the best time when most team members could attend. So we are very fortunate here in Sheffield that we have a really good local hospital cancer charity who could provide us with a room that we could use. So it's not actually in the hospital grounds, it's just outside. So we were able to kind of tap into them and use their rooms every other month. So all team members received a Teams invite to hold it in their work diaries so they could block this time off. When people come to me asking how much it costs nothing. To set something up like this is just basically the willingness of your teams and the time. And if you have those connections with charities who can provide you a space, or if you have a safe space in your working environment, that's something else you can use. So it costs nothing to set this up. So these are some lovely pictures of our teams with some of their comments. So after our first meeting with psychology, we trialed that bi-monthly hour-long meeting with a CBT therapist. The sessions were face-to-face. It was actually really good. The first session is kind of like setting grounds, what we wanted to achieve, why we needed the sessions. And as you can imagine, people are coming into these sessions with their own backgrounds. So everyone's got trauma and things outside of work that can impact them. So the CBT therapist went through kind of what we wanted to achieve as a group. Was this the best idea for the group? And we kind of set some ground rules that things stayed inside the meeting. We didn't take notes. It wasn't that kind of meeting. Nobody would have their work phone faced upwards, so we couldn't see any messages, and they'll be on silent. It was our hour once every 2 months to go through what we were kind of dealing with in work. So we also ended each session with a 5-minute mindfulness practice, which was done by the CBT therapist. Again, to me, I'm not a mindful person before this, and to me it was a bit cringy, but actually having that 5 minutes where you can reflect on the session, where you can just take that 5 minutes to breathe and think about, actually, I now have to go back and deal with a lot of tricky situations, actually really, really helps. So we didn't have any agendas to start with. We just looked at the team's emotional well-being as opposed to patient-related, which is, again, really hard in healthcare. We focus all our time and passion on our young people, which is how it should be. But I often think we forget to look after ourselves, and just in healthcare in general, we kind of come to work, do our shift, go home, and we do a lot of trauma. Think of where you are in your workplace and think of the things you do when you go home and tell a loved one or a family member, and their faces cannot believe what you've gone through. So having the safe space to talk through difficult situations has actually benefited me personally and the team. We then looked at targeted issues like difficult conversations that we may be having, bereavement support, how we can debrief ourselves as a team and other teams. And we did that for, I think, between 5 and 10 sessions. And then we did an anonymised survey. And as you can see on the picture there, that's just some of the kind of free text feedback we had from different members of the team. So that was sent to all participants. Feedback provided evidence of how highly evaluated the project had been. So 100% of participants rated the sessions a 5 out of 5 with very likely to recommend colleagues, and 7 out of the 8 participants rated as having a positive impact on their well-being. So what we did then, we obviously looked and went, right, so what can we now do with this information? So we looked at and regrouped, how do we move forward? So we decided actually the bi-monthly sessions were too far apart. We were getting to the point where we needed them earlier. Everyone was looking forward to them, which was really positive to hear. So we decided to increase them to monthly, and we kept them on a Thursday. And we found that the mindful sessions were really beneficial for our team members. They found them actually having that kind of safe space just to do something with, like, creative with their hands, like making bracelets, or doing some like paperwork with like quotes and things, help them have those conversations they wouldn't necessarily have with their colleagues in the office. And then what we have done as well since this is we have changed it. So our CBT therapist comes by monthly now because she's realised actually we can facilitate them ourselves. We don't need to have these kind of more guided sessions with her. So what we do currently is on a Tuesday now after our MDT meeting, we all go to it, the in area psychology session at the cancer charity, and we do something focused. So we had it yesterday and we focused on the issues we're facing with young people and their families at the moment, and how we can work together to kind of protect ourselves from the emotional stress that we kind of sometimes feel. And then next month we will go out into nature. The team thought actually being out for an hour just to breathe air, because often we're in hospitals all the time. We don't get to see daylight unless it's through a window. And we've done things like yoga. We've done things like we've walked around Weston Park Museum because it's free. It's a free activity. We have no cash. We have no money to spend on things like this. We've done grounding exercises. So the team have gone and basically put their feet on the grass, no shoes. I know it sounds weird. They enjoyed it. That's the most important thing. And we've done things like very childish things. So we've played an Italian like TIG game, which then releases lots of endorphins because exercise releases happy hormones. So we've adapted our psychology sessions to meet the needs of our team, which has been fantastic. So again, some of the pictures of our team. So what have we seen within our team? We've noticed a massive improvement in communication. The team are talking a lot more about how they're feeling, about the kind of things at work, and that's actually benefited us. It's made us much more close as a team, and it's helped kind of improve communication as well with other teams. We're more responsive now. So whereas before you may have sent us an email or a text and we might have kind of been like, oh, I don't want to reply to that. Right, let's reply, let's get on with it, let's do it. So again, that's increased our productivity. It's helped us focus as a team on what our service priorities are and how we can work together to develop our service. And as you can see in the pictures, we've won an award this year from actually the work we've done, which is massive. So having this psychology session built into our team for the last 2 years actually massively improved what we're doing. It's helped reduce compassion fatigue and burnout. We're seeing less staff off with short-term absences. So overall, it's had a massively positive impact on us, and it only costs us in time 1 hour a month. I like this picture just because it's back to the future. The positive outcomes of these sessions have demonstrated the importance of professionals who care for TYAs having cancer, having a dedicated space to focus on their mental health needs. So all this was designed to provide psychological support to team members. It's improved our communication and helped unify and strengthen our team. The distinctive features of this include its flexibility. So if we can't do a Tuesday, we can change it to whatever the team can do. Its responsiveness to participants' needs. So if we are having a session and actually we've had a lot of bereavements, young people passing away, we can focus the sessions on those to deal with those issues at the time. And it's also promoted self-care. Team now, for myself, for example, I could plan my route to work with the radio. I knew where I had to be at certain times for the radio. I don't listen to the radio anymore. I listen to music on the way off my phone. Simple things like that have helped me as a lead nurse and the rest of the team just be more present when we are at work. So we've had no funding for this. It relies on the willingness of the CBT therapist. It relies on the willingness of the team. It relies on the charity. But that hasn't hindered us. These sessions are now part of our monthly routine, and the next step is kind of to offer this support wider, so to anyone looking after TYAs within the region. So for example, radiotherapists, site-specific clinical nurse specialists, but again, it's them having that time and availability to attend, which we know is hard, but then we're looking at how we can make this more bespoke to them. Is it that we can offer maybe like guided meditation to them or something that we can send out? That's something we're working on currently. Another development would be we'd like to kind of have those more in-depth conversations. We have done this recently. We've had more challenging subjects such as dying and death talked about, but it's always kind of seen as a heavier psychological session. So we're trying to see how we can make those more improved and attended better. And then just encouraging these discussions and these subjects also can help us reduce avoidance and alienation, and it enhances that connection and fostering a positive culture where staff feel comfortable showing their vulnerability and accessing support. And we're very fortunate to be able to publish how this has worked, and that's a copy of our article, which hopefully that link will work and you can access. And that is it from me.
Wonderful, thanks, Liz. Do you know it's always it's so inspiring to hear about the support that's given to our staff members. You know, we like you say, we quite often forget that these scenarios and these individuals and these cases that we're supporting can be really, you know, emotionally charged, and investing that time into people's well-being and things is so important. So thank you for sharing that with us. That was really, really useful for me, definitely. So we'll move on to Q&A. If you do have any questions, please post them in the Q&A. Nat, have we any that we can share?
Yeah, if we start off with, for Liz, what were the biggest challenges in implementing something like this for yourselves?
So I was quite new to the team 3 years ago, and some of the team have been here for a long time, like we're talking like 10, 15 years. And it's kind of like changing that habit because they've kind of dealt with things by themselves. They didn't seem to have to do it. They just did the whole, you know, how you go to an office and you go, oh my God, I've had this situation. Um, but then nothing was followed up in. They didn't kind of deal with the situation, just kind of vented and that was it. So kind of the biggest thing was kind of get people to buy into it. It was that whole kind of, what is it? Is it supervision? Is it psychological support? That was also a question we had to ask ourselves. And then it's that whole like tricky thing which everyone asks all the time. How do you pay for it? How's it cost? And it's that whole thing, is your time, what is your time worth? So yes, we're all really busy, and like we've seen a massive increase in our young people, referred into as like a 24% increase in the last year. And we know everyone's time is so precious, but that having that time, that 1 hour, literally just 1 hour, so it could be that you come in a bit earlier or you leave a bit later, or you just, that's your lunch break, just 1 hour a month to have that time where you can actually sit down in a safe space with your colleagues and just talk about how you're feeling, what's going on, what's impacting you. The fact that home life has a massive impact on your work, and you probably don't realize it because you're in that tunnel of, I just have to do my tasks today. But if you've like, most kids have gone back to school today. If your kids have gone back to school and you've had a really difficult morning getting them out of bed, trying to get in, and then you come into work to have to deal with a young person who's refusing their medication, your bandwidth isn't going to be there unless you have that support in place. So that was a difficult thing, just trying to get everyone's input, everyone to buy into it, and finding where we could do it in a safe way.
Thanks, Liz. I've got another question for you. How did you promote this across the team so that staff felt comfortable in attending, but also sharing their experiences?
Yeah, so the team were asked what they wanted, and we did go to the more kind of not old in age, but older in like being in the team, kind of what they wanted. Because actually they asked for it. They said they'd have never had that kind of support before, and that's what they wanted. So we kind of mentioned it at one of our MDT meetings about it, and then we also have a business meeting every year, and we said we're gonna do this. And it's just that it's as simple as that. There's nothing complicated, and it was like an email chain, like or a Teams poll, like what day works best. And I can see most of my team's calendars, but for example, those who are based at the Children's Hospital, which is literally a 2-minute walk down the road, I can't see what they're doing. It's just having that open conversation. What works for you? What should we do? When should we do it? And that's simple. It's that simple. That's why I can't get my head around. And everyone who's working in cancer should have mental health support, and that's not happening across the UK.
I think that's really interesting because I think, especially when staff are sharing those experiences, I can imagine it can be difficult to talk about, but it's really great to hear that by having those initial conversations with staff, especially around what are your needs and what can we do to support you, that almost creates that culture already of this is a safe space, you know, for you to speak out. So it's great to hear that that's how it was all panned out.
Yeah, an example yesterday, we had one of our kind of more our serious psychology sessions with Julia, who's our beautiful CBT therapist. And we had tears because it wasn't to do with work, it was actually to do with home life, how that's impacting on our headspace and how actually they're coming to work to kind of have that normality. So things are shared in that group, and it's such a safe space that people feel that they can kind of show their emotions. It took
Yeah.
time to get there, but it does work now.
That's brilliant. There is another question there. So you've touched upon this just then actually in your answer a little bit. But are the sessions during work hours? And if so, how do you combat issues like backfill costs and finding the time for staff to attend important support sessions like this?
Good question. So I'm the lead nurse, so I can kind of decide what the majority of the team do. We don't have backfill costs. We are an adaptive team, so we work strange hours anyway to meet the needs of our young people. As you probably know, young people don't tend to get out of bed till gone 10, which is perfectly normal. That's our hormones. So we kind of adapt anyway. So the hour is we don't tend to have lunch breaks because we eat at our desk while we're working. So it's an accumulation of all the hours we haven't had for that 1 hour a month. I know it sounds ridiculous, but we don't have set clinics on those days. We do have clinics, but we have the clinics on the Tuesday, so our sessions are on a Thursday. It's the time that most of the team had with nothing in their diary, booked in, set, no meetings, no nothing. So that's why we chose that Thursday. And then the Tuesday sessions, which are the more serious ones, is straight after our MDT. We normally book out an hour after that for what we call care planning, where we just go through maybe any patient issues we're having. But what we decided as a team was that we would delay that session to the week after, and we'll just have our psychology session in that place. So we don't have any backfill costs in that sense.
Brilliant.
That answers the question.
Yeah,
if not, I'm sorry.
Just having a look through, I don't think there's any more questions there, but I guess just to wrap up and just get your thoughts on this, what would be kind of your main bit of advice, Liz, for someone who is in a similar lead nurse position to yourself at another trust and wanted to kind of go on this journey of embedding this initiative for staff to support the mental health side? What would be your main bit of advice for them if they were to start something like this?
Yeah, so just scope out what is available. I know in like adult hospitals that psychology is a scarce commodity. I know that it's difficult out there, and we're very fortunate that we do have a fantastic psychology service. But just see what is available. There are charities out there that can help. So if you're not getting anywhere like the NHS route, think outside the box, look at charities. Think what's important to you and your team. Is it actually your psychology session is actually once a month, you and your team just go for a walk around the hospital outside and just chat about things. There are ways to adapt it. And if you want, just reach out and I will happily help in any way I can.
Thank you, Liz. What we'll do is we'll share the slides, and of course we've recorded the session today so people can get in contact if they'd like to. I'll pass this back on to Gemma.
Lovely, thanks, Nat. So what will you do with the information that you've heard today? So I know for me, that's mine about implementing in my team, even though my team don't work in a hospital setting. I think what you're talking about, Liz, around that psychological safety, allowing people to bring their whole selves to work, it's quite often lip service, isn't it, that we say, you're supported at work, but being able to protect that time and to be able to offer that safe space for people to talk about anything that they want to, and to recognize that home lives do impact what's happening in your job. And I think even though we're not in a clinical setting here at Health Innovation Yorkshire Humber, we do still deal with some challenging situations, and we're all people at the end of the day. So I'm definitely going to take what you've sort of said and think about how we can bring it over into our organisation for sure.
But it's not just cancer as well. This can be in any situation. I've worked in general peds, and the same like you have so many situations just in life, personal and at work, that can actually impact your mental health. And I like to think I'm a strong person, but there's things that I've had happen at home and at work which other people probably wouldn't have dealt with. But it's just having that person or those people that and your team is that one group of people that you should be able to go to with anything.
Absolutely.
So, and we've noticed that we've noticed the amount of actually openness within the team now as well, which is fantastic.
Wonderful, that really is. Okay, and finally, just to wrap up, this is our last question. So would you attend another bite-sized session? As I said, we've got plenty now running. This is the first of our sessions, and then we run all the way through until January with various different topics and speakers. And there'll be different chairs, there'll be different areas of South Yorkshire covered. So that's great to see that everyone is looking forward to the future. So it just leaves with me. Thanks for everyone for attending today. Appreciate you taking the time out of your busy diaries, and thank you to Liz for sharing the work that they do at Sheffield. Just finally, all our bite-sized webinars, they will be recorded, like I said, and uploaded to the South Yorkshire Innovation Hub for you to share with your colleagues and to look back. And to book onto any of our future bite-size sessions, we're going to put the link in the chat for you to have a look at those as well. So thanks again to everyone and enjoy the rest of your day. Thank you.
Thank you.